Whew. Oh, there we go. What's up, world? Uko here from Better Therapy Now. So, grieving. This is something that I often deal with in just at therapeutic settings. I work in addiction treatment, and many people uh, fall into addiction as a result of seeing many people pass away in their lives. Friends, family, uh, significant others, children, just dealing with that and trying to really avoid dealing with it and escaping those emotions lead them into addiction, turning to alcohol, turning to drugs. And then once they decide to go into recovery, they often have a lot of emotions kind of come up for them. And the grieving process is something that is commonly worked through in therapeutic settings, in inpatient settings, especially in inpatient settings, because they go into these facilities. Their body is detoxing drugs. Like there's kind of like a current detox where they're really having hard withdrawals, and then there is a detox, like a post detox, where a lot of medical issues are coming to the surface, and a lot of emotions are coming to the surface. And grieving is all a part of that process. And one therapeutic intervention that is really common that I've used in the past is acceptance and commitment therapy, known as ACT or ACT. And what this does is it encourages people to face emotions rather than suppressing those emotions. Sometimes it can feel really uncomfortable because people will be crying and sitting with their sadness in a quiet room as they're talking through these events. But what the intervention is doing is it is allowing them to face those emotions in a sober way while their body is sober and their mind is sober, so that when they go back out into the world and back out into their life and those thoughts pop up into their mind or they get sad again, it isn't the first time that they've dealt with it while sober. So it makes it less likely that they'll turn to alcohol or turn to drugs again. And if they do it enough times, they begin to, one, process and accept the reality of the situation, and they become much more stronger in the face of the emotions. Attachment and commitment theory also helps people address negative thought patterns when it comes to those to the grieving process and how they feel about their own emotions. Things like I'll never be happy again, or I'll never be safe again, or I'll never be confident or productive again. Those things can be challenged both by themselves in the therapeutic setting and by the therapist when they're kind of talking through it. You can use silence as a sort of not weapon, but as a strategy, because people often try to fill that silence with words. And when they're filling that silence, they're just saying kind of whatever comes to their mind to feel it, to fill that silence. And a lot of what comes out is the truth. And they don't even notice how they're speaking. And then you kind of capture that and present that to them by telling them that, no, it's not that you're not going to ever be happy again. It's just that you're not happy in this moment due to what you're going through. Present moment awareness is the third principle of acceptance and commitment theory. And the two most common emotions that you run into, or the two most, I guess, common mental illnesses that you'll run into, are depression, which is concern about what has happened in the past, and then anxiety, which is concern and sometimes obsession about what might happen in the future. So, doing grounding techniques and mindfulness exercise, I know it's said in every therapeutic video, but it'll bring you into the present. And I think adding a layer of intensity to the grounding or breathing exercise or mindfulness practice can be even more beneficial. Things like breathe, specific breathing exercises that give you what I call a breathing hunger. So maybe you're exhaling more than you're inhaling, and it causes you to feel a little bit out of breath. That can take you out of the past and the future and put you in the present, because your brain is thinking, hey, I need more air. So you're just much more grounded in the present moment and not worried about whatever it was you were thinking about that made you sad, and just thinking about the present moment. The next part, and I think my favorite part of acceptance and commitment theory, is commitment to not commitment to value-based living. So value-based living requires them to identify what they value in life, maybe core values. Their family might be something that they value very much, or their goals set. But identify that and then come up with some type of commitment to action to move toward that goal. In most instances, the grieving process has to end, not necessarily end, but come to some sort of ritual or um, closure process. A lot of the times, people that I talk to, their parents passed away, or their grandparents passed away, or a child passed away, and they've never even been to the gravesite. And that is a very important action to commit to, going back to that gravesite and paying final respects. I talk about acceptance and commitment therapy because it's in line with values. It starts out with acceptance, addressing emotions. In the mid portion, you're doing mindfulness and grounding techniques, and then it ends with an exploration of values and a commitment to action.